Exercise is beneficial for individuals impacted by cancer. Hi, I'm Dr. Patty, physical therapist, lymphedema, and cancer rehab specialist. These exercises are created to give you things that you can do for yourself throughout the cancer care journey. Before we begin, you should contact your healthcare provider and your cancer rehab or lymphedema therapist to help understand what lymphatic exercises are most appropriate to you. Today, we're going to go over improving our lymphatic system and lymphatic flow. This is a very general exercise routine for individuals throughout our body. But let's get started. All you need is your smile and a chair. You can perform this in the shower, sitting down, lying down. Let's get started. We're going to put our hands onto our stomach, in through our nose, out through our mouth. You're going to kind of push your abdominal into your hand so you feel a little bit of a counter pressure. What this actually does, it helps improve our lymphatic flow up to 100 times. So it helps push our fluid back up to our heart. The lymphatic system, super important. It has a complex network that helps navigate fluid and particles. It helps get rid of waste, and it also helps improve our immune system. So these exercises that we're doing today is to wake up our lymph nodes and lymphatic vessels. I'm going to take our hands, we're going to go right to the side of our neck, and you're just going to make a little soft circle. The goal is to stretch the skin. It should be very light. And you're just waking up all these wonderful lymph nodes that are in your neck. Sometimes you might feel when you're starting to get sick, you might feel a little heaviness, you might feel a little sore, so keep it nice and gentle. I usually do somewhere between 5 to 10. Today I'll be doing about 8 to each side. I'm going to switch sides. Nice little C shape, stretching the skin and pulling it. Stretching the skin and pulling it. Waking up those lymph nodes and lymphatic vessels and getting those valves working to their optimal performance. We have lymph nodes, we have deep lymph nodes that are in our gut. They help regulate and kind of protect from bad things coming in. So what we're going to do is we're going to wake up some of the deep lymph nodes. So you're going to take your fingers, you're going to go on either side of your breastbone, and you kind of like push into them. Hold 1, 2, 3, and relax. We're going to do 8 of them. Now we're going to take one hand, we're going to go one hand down. So it's going to be right around our breast or chest area. Again, we're going to kind of push in to either side of our breastbone. Hold 1, 2, 3. We'll do 8 of them. Okay. So when we talk superficial lymphatic system, we have it divided into a quadrant. So everything from the collarbone up drains typically to our neck area. Everything from, like, if you get cut down through your belly button, everything on your right side drains to your right side. Everything on your left side drains to your left side. So then there's quadrants. There's the upper and the lower quadrant. Generally speaking, everything our rib cage and up gets drained into our axilla or armpit. And so what we're going to do today is we're going to open up our armpit on either side. So what you're going to do is you're going to take your hand, you really like have the whole palm, the whole contact. You're going to go right underneath and you're going to scoop. Scoop into the armpit, hold for a moment, scoop, scoop. Again, very light, very gentle. It's best to do this on skin. So for many people, I often recommend that they do it in the shower. Scooping, waking up those healthy lymph nodes. Wonderful. We'll go ahead and switch sides. Lymph nodes can be damaged secondary to surgery. You can also get damaged potentially because of radiation. And some people are born with left lymph nodes or more congenital. So there's many reasons why you may have some lymphatic damage. That's why really a meeting with a provider to go over your specific risk is so helpful. So we scooped up, now we're gonna scoop down. So what you'll do is you'll take your collarbone area and you'll go right behind your collarbone, there's a little area, and you just kind of scoop it down. You're just making like a little C. You're just going stretching the skin. Scoop down, stretch the skin. Scoop down, stretch the skin. Scoop down, stretch the skin. If you have a port or something in place, make sure you stay away from that area. Okay, take your other hand. Again, right below this collarbone area, you're scooping into the armpit or the axilla. All right, so we opened up the upper quadrant. Now we're going to open up the lower quadrant. You can do this sitting or standing. I'm going to do it sitting today. So you have your inguinal or your groin lymph nodes. They're located right along this area. What we're going to do is, again, we're going to scoop in. Again, best to do skin on skin, but I'm wearing pants today. Hold 1, 2, 3. 1, 2, 3. And we're going to do 8 of them. One cool thing about the lymphatic system is it typically doesn't work. It has a lot of capacity. So it's one of the reasons why you can sprain your ankle and you won't develop lymphedema. Our body does heal its lymphatic vessels. The challenge is if the lymph nodes are removed or if the lymph nodes are damaged because of radiation or surgery, it can sometimes impede its ability to function. Go ahead and switch sides. Again, scooping, stretching the skin. I kind of like doing these in the morning, but you can do them any time of the day. Kind of think the thought process is, let's wake up all these lymph nodes, let's wake up our whole lymphatic system so it can maximize throughout our day. Some individuals will find that throughout the day, they may just feel like they're getting some heaviness, but other types of cancer conditions actually may feel heavier or more swollen in the morning. Wonderful. So we have opened up at the neck, axilla, and our groin. We're just going to end the way we started, placing our hands on our abdominals, and we're just going to make a circle that goes around our abdominal cavity, maximizing our diaphragm, expanding our rib cage. And in. And in. And in. And in. If you're interested in learning more or you have questions or comments, feel free to leave a comment. I'll be putting together some more videos that are a little bit more specific for specific cancer diagnoses or procedures. But this is a wonderful program to start to maximize your lymphatic flow. See you again soon.